Hi there, I'm Jenny Thomas and I'm co-producing Femtech TV with Catherine. Great to be with you here today. My day job, I run Digital Health London, and we support digital health startups through our accelerator and launchpad, and we support NHS staff with digital transformation projects. We also do lots of work in evidence generation for digital health. But my personal passion is Femtech, and I'm delighted to start my first interview. I'm really looking at the kind of UK ecosystem for Femtech, and I'm here today with Dr Hiba Saleem. She is an obs and gynae doctor. You can see that she's actually in a hospital at the moment in the
Hi.
And she works at St Mary's Hospital in London, but she also has a leadership role in Hillingdon Hospital. She is the, I hope I get this right, the Associate Chief Digital Officer. Is that right?
Yeah, it's a mouthful. Associate Chief Clinical Digital Officer.
So it's really fantastic to have you with me here today. Really looking forward to asking you some questions about Femtech and the NHS. So let's get started, if that's okay.
Yeah, I mean, I'm really excited to speak to you because of all the amazing things I've heard about Digital Health London and all the like, you know, all the support you've given so many startups to help the way that we all work.
Oh, thank you. So let's kick off. So tell us about you, your organisation.
So I, like you said, like you mentioned, so by background, I'm an obs and gynae doctor. I've just started my specialty training in Northwest London, and my kind of external role, and one of the things I'm most passionate about has always been digital health and how we can use technology to improve the way that we practice as clinicians, support our, you know, our affiliate staffing and our colleagues, and basically how do we improve care for patients. So in that, in the last nearly a year now, I've been working very closely with the management team at Hillingdon Hospital and the digital services team, and recently was appointed associate CCIO at Hillingdon. And in this role, I work together very closely with the digital services team to basically find our pain points, work out what we need to do better, how are we going to integrate tech, and working very closely with the clinical teams to create platforms and technology and integrate different processes to help patient care, to optimize our efficiency in our day-to-day work, and just generally improve to the care that we're delivering for our patients.
Great, thank you. And so what does Femtech mean to you and to your organisation? I mean, do you think about it much? Do you talk about it in your organisation?
I think so. Personally, for me, Femtech is a great passion of mine and an area of interest, because having now obviously started my specialty training obs and gynae, my whole life is women's health now. So Femtech is basically, it's something I won't be able to live without now. With a passion in digital and working women's health, I think it's something that unfortunately has always been quite a niche subject or a niche topic, and is only recently kind of come to the forefront, where with Femtech we're looking about 50% of our population. It should be the norm. We should be talking about it more and more. I'll be honest, I don't think we talk about it enough in the NHS yet. I think the private sector is leading the way in creating so many amazing solutions and different, you know, apps and platforms, technology, different devices as well, that we're only recently starting to see the emergence of. In all honesty, my current job is about kind of improving the service delivery and patient care in general. But what I would like to do personally is to be able to sway us towards focusing on this. I think there are so many opportunities to improve maternity care, to improve, you know, women's health in general for older women, and in terms of menopause, in terms of antenatal, postnatal care. And I think this is something that will become increasingly a focus for me and for our team, so that we can improve, you know, women's health in general using these different technologies.
Well, that's really great to hear. So which bits of Femtech are you most excited about? I mean, I think what everyone will be really interested to hear in particular is, where do you feel the pain points are? You know, what do you see as an obs and gynae doctor in the NHS?
Yeah, I mean, there are many pain points to begin with. The things that I'm most excited about are, how do we how do we start simple with just simple things that we can integrate to be able to connect patients to clinicians a bit better. For example, when a woman is going through the process of all her antenatal care, how can we integrate, collect better data, be able to provide more personalized care? And this is something that we can do as simple, like how do we make sure we're monitoring gestational diabetes correctly? Why do we still have paper diaries of people writing BMs by hand? Why do we not have better platforms to integrate this, for us to provide greater visibility for clinicians, for us to act earlier and not be relying on, on all this paper so much? There are lots of opportunities in terms of care during menopause. How do we educate women better? How do we ensure they understand what the different options are? I think something like menopause, unfortunately, is left to the GPs to deal with. And in a 10-minute consultation, I don't think it's easy for either the patient or the doctor to be able to manage situations like this effectively. And there are lots of opportunities to be able to use not just pharmacology, but to be able to use different devices, different more holistic approaches and treatments to be able to help women manage things like menopause. There's on a local level, I think we obviously are very good. In the UK, the NHS provides fantastic support to women when they're going through labour and post that as well. But I think on an international level, there are so many opportunities for us to be able to support more developing countries in reaching better clinician, better access to care. There are lots of cool apps and platforms. I mean, I recently did actually an interview with Nadine, who's the founder of Proximy, which is an online platform that allows different clinicians to use videos and online software to be able to see different operations and to be able to help clinicians understand more complex procedures, help them assist, sorry, be able to assist with, yes, 10 minutes? Sorry about that.
No, that's fine.
I lost my train of thought there, but yeah, I mean, there are more and more platforms that we can use and technology to be able to improve care, not just on a local level, but be able to disseminate that and be able to help other surgeons to improve the way that they might be doing a hysterectomy. We can dial in surgeons from different parts of the world to say, okay, we're doing this complex grade 4 cancer treatment, or we're going to do, we're gonna look inside. We've got stage 4 endometriosis. How can you help us? How can we support one another to be able to provide better care across the globe? So there are things that on a local level I'd like to see, simple things that we can tick off. But I think we're only just getting started with Femtech, unfortunately.
Yeah, I definitely would agree. And before, you said some interesting things about when you were looking after women on the labour ward and the sorts of questions that they would ask you just as being discharged, and some of the kind of challenges there. And do you want to say anything about that?
I think as good as a job we do as clinicians, and as hard as we try, we're not very good at providing continuity of care to women, and that's just largely because of the way that we work, the way that our shifts are, or patterns and the service provision we have to provide. But the most important thing for a woman who's going home with a new baby is, how am I going to support my baby? What do I do? How does my wound heal if I've had a cesarean section? What if I can't, I'm having problems breastfeeding? What if I had preeclampsia, or I had high blood pressure before? How do I manage these things? There are a lot of questions that women go home with, and they're stuck in the middle. Like, how do we, and I want to be able to support that. I think there are lots of opportunities to be able to educate women, provide them. I want to make sure that when a woman goes home, I can point her in the right direction for all of those things. I might not be able to answer every question, but I should be able to say, here's where you can find support with breastfeeding. Here's what you need to do if X happens or Y happens. And I think with the emergence of newer technologies that can support us with that, we'll be able to work much better in making sure that we provide that complete holistic care for women. And there are lots of great people doing these things. And on a local level, we've seen lots of different support groups that are available. But I think we can do more. basically. And I
Yeah.
want to be able to point people to all those different things, because I don't have the answers to everything. You know, there are much better people out there who can answer a lot of the other questions. And there are opportunities for apps and different kinds of technologies to be able to bridge those gaps.
Yeah, I absolutely agree. Having been a general manager for women's myself,
Exactly.
yeah,
You'll know a lot about a lot of this stuff, and how we can, you know, where those different pain points are, not just on a clinical level, but also logistically. Like you
yeah,
can't forget, when a woman's
absolutely.
going home, it's not just about how she feels, but how is she going to manage post-op with all the other things that she needs to do. And we have to remember not to forget those pain points for the patient as well.
Yeah, absolutely. So you were saying earlier that femtech is kind of really in its like early days, but you feel there's a lot of potential. Do you have any like successes as an organization at all in this space, or is there anything in particular that you're really proud about? And it may be more kind of in general, in terms of general
Yeah.
digital health.
So recently, I mean, COVID in a way really helped us accelerate a lot of digital transformation within our trust. It really helped us rethink the way that we're delivering care on a specific women's health level. Like, one of the things that we introduced and integrated was kind of virtual consultations that we're now doing. We're now seeing thousands of them, highest proportion actually across gynecology as well, in terms of follow-ups, and being able to now access people virtually via online, by calls or by video. That's really helped us in terms of in our women's health department, being able to reach women in that way, being able to provide post-op care, postnatal care, and not just kind of putting them on a wait list for like 6 months. We're able to reach people much sooner. There's also we've introduced new platforms for advice and guidance. So we've got now, when GPs have problems, so if there are questions with women's health, or we're having postmenopausal bleeding, or whatever the different issues are, obviously there are those immediate kind of 2-week pathways, but then we've got these newer advice and guidance systems where we're kind of giving a 24-hour turnaround. So in the past, where you might send a referral and wait for someone to then see and vet and then send an appointment, we're actually sending out direct advice much sooner, so that women are treated or guided guided a bit sooner. And that might mean that they still have to have an appointment and go onto that waiting list and come in and be seen. But in the interim, we're able to do a little bit more for them. And that's what we need to aim towards, is being able to provide this care and answer these questions much sooner. So that's something I'm quite proud of in the last few months, to be able to come down and be able to provide that within a 24-hour turnaround. And that's amongst other things. Some of the other projects I worked on there are lots of platforms like Dr and Patient Knows Best, which we're different across Imperial and other Northwest trusts are starting to use now, to be able to improve patient visibility to their own records, to give them direct communication so they know what's going on, because we need to move away from this historic system of these letters that get sent in the post, and you're waiting for weeks to understand what happened, what your follow-up is. I think where everywhere outside of healthcare we have an expectation, and with banking and other industries, that everything should be immediate and visible and easily accessible, but for some reason in healthcare we're still kind of lagging behind. So we're trying to get there. Hillingdon especially is going through a big digital transformation with the integration of electronic health records that will happen next year. So we're moving away from a paper-based system to be able to help us just basically improve the patient care that we're delivering in general. So there's lots of different projects that are ongoing. We also hold something called the Digital Den every fortnight, where people can just come to us with problems or come to us with solutions. That's been a really, really great platform, I think, because we've had everyone, whether it could be anybody who's working in the hospital at any department in any position, can come to us and say, I've got this problem, or can come to us with a suggestion. And lots of these have been implemented, which is great, whether that's like devices for remote ECG monitoring. We've now set up like a remote kind of COVID monitoring, so people who come in and seen by the respiratory team can actually then be monitoring them up and following them up at home, allowing us to reach more people and increase capacity within the hospital. So there's lots of great things like that are happening, and I'd like to, my personal interest will always obviously be to for us to introduce that can help women's health as well. But we're getting there.
It's great. I love the digital den. It's
yeah, you need to join one of them actually. It'll be amazing to with all the experience with all the startups we supported with digital health to be able to come in and give us a few insights there as well.
Yeah, definitely. Yeah, no, I know at least one of the startups that went through our accelerator pitched at the Dragon's Den.
Yeah.
So yeah, it's a really great initiative, and I definitely think it's something that would be really beneficial if it's one of those best practices that other organisations, if they adopted it, I think would gain a huge amount from it. So lastly, I just wanted to talk about kind of what's next for you, what's next for Femtech. And I mean, I just also wanted to share that when we didn't meet, but when I first heard you speak was at the Digital Summer School, which for those of you outside the UK that you may not have heard of, that this is when all of the kind of digital leaders in the NHS come together for a big event that took place virtually this year in the summer. And I heard you speak, you're one of the rising stars in digital, and you were interviewing various people at NHSX. I just thought it was wonderful listening to you and kind of hearing your thoughts, and also asking really challenging questions to the panel. But what is next for you? I mean, clearly, I think you're going to do great things in digital. You, and what's next for Femtech?
For me personally, now that I am specialized in women's health, it's like my two favorite things combining. I think that there are lots of things I want to be able to do on, within this job specification. I really want to transform the way that that patients can communicate with us, the way that they can access information. I don't want any patient to ever leave that I've seen with any questions unanswered, or kind of confused, or unsure of what's next, basically. But on a kind of wider level, I feel like there are so many things I'd like to do internationally as well to support and I have a personal interest in, obviously, connection back home, Pakistan and India, where I'd love to be able to work on improving women's health access and care out there. There are loads of things and great charities that exist already that we can support. They're doing some fantastic things, like even little things like being able to use virtual teleconsultations to connect people, using amazing platforms like Proxime and others to be able to train and help improve the way that care is delivered there. Even things like being able to go out and set up, train and create like hub and spoke models to be able to train kind of more remote areas in handling these common things that, the morbidity mortality rate in these countries for women who are having babies is shockingly high, and for simple things that we should be able to resolve. So I think there's a huge part for technology to play for us to improve that. And I think my whole career now going forward will be about using technology to improve, my day-to-day clinical, which is women. And Femtech for me is the focus of everything that I'm doing. And while I've not necessarily had great success or been involved in Femtech specifically until now, it's something that I would like to focus on. And I love hearing other people speak at conferences like that and other places, because I'm so inspired by so many different solutions that are out there, people that are doing great things. At Wired, when I heard the founder of LV speak as well, which is now available on the NHS, I think where people are chipping away and doing great things. And I think with greater conversation and visibility around Femtech, we will achieve a lot more. I think in the next 5 to 10 years will be quite defining for us.
Well, it's been so great to talk to you today. Thank you. Wonderful to know that
Thanks,
you're there combining your passion for digital health and for women's health. I feel the same way. It's those kind of things.
I know.
They're really important to both of us, and it's great to be working with you on this in the years to come, I'm sure.
I'm sure we will come up with a few of our own solutions in the years to come.
Yes.
I look forward to working with you on that.
Yes, thank you so much.
Thanks, Jenny. Ooh.